Hello, I'm Maarten Lambrechts, and I'm delighted to be invited to talk to you about visualization in the context of global health today. I think we all have seen how important data and data literacy, the capacity to interpret data in a correct way, can be very important in health during the past year with the COVID-19 pandemic. What I would like to do with you today is to share some of my work I did in that area. I've been working with the World Bank on something called the Sustainable Development Goal Atlas. The atlas contains one chapter about health, and that's a chapter I worked on. So I'll be sharing with you the story about global health we made, and I'll be discussing with you the visualizations and some of the background of those visualizations. I'm also going to share two other chapters of the Sustainable Development Goals who are also tangential to health. And at the end, I would share with you some of the more interesting visualizations or visual stories around the pandemic that were published last year to give you some inspiration of what you can do to make visualizations about the pandemic and other health topics. But let me introduce myself a little bit first. So my name is Maarten Lambrechts. I'm based in Belgium. I'm from the Dutch-speaking part of Belgium, Flanders. And I work as a freelance data journalist, a data designer, and visualization consultant, which means that I really specialize in data visualization. I make static and interactive charts and maps for many different clients. Among my clients, you can find government agencies, companies, but also nonprofits. And my tagline is a bit that I help them communicate their numbers. I also have a little bit of experience working in the media. I have worked for a couple of years at a Belgian newspaper called The Tijd, where I was working as a data journalist. So I try to find stories in databases and spreadsheets and then bring those stories to to our readers by combining the visuals with the text. So that was what I was doing working at the newspaper. Today, I do many different things also outside media. So I give courses about visualization. I develop and evaluate visualizations, and I also help to build visualization tools. So this is my website. You can find some of my work in the Made section. If you'd like, you can take a look at that. There's also a section called Written, where I publish smaller visualizations, and sometimes I also write how-to guides. In this section, you will also find the list of the 2020 visualization list. This is something that we will be discussing at the end of this session. But let's start with the Atlas of Sustainable Development Goals. So what is the Atlas? The Sustainable Development Goals are global goals set a couple of years back, I think in 2015, and they really touch upon many topics and issues that the world is dealing with today. And the goals were divided up into 17 different topics. And here you can see some of them. So the Sustainable Development Goal is about poverty. The second one is about zero hunger. And the third one is about health and well-being. And as you can see, there are many more. So I'll highlight only some of them in this session, but I really invite you to go through some of these stories. They are very data-driven with a lot of visualizations, so they are quite easy to consume. In fact, this was the first time that the World Bank decided to publish a publication online only. So there is no printed atlas. There is also no PDF that you can download. It's all online. And the nice thing about the Sustainable Development Goals Atlas 2020 is that we, as the people building the atlas, were given a lot of freedom to make use as much as possible of all the interactive features that you have in an online environment. So it's very visual and also very interactive, as you'll notice. Um, the way we made this atlas was that there was a small team at the World Bank who were responsible for producing the atlas, and they were like the people between the real topic experts at the World Bank and the researchers there. And then I was part of a small data visualization team responsible for making the visualizations and also building the interactive stories. So we were four people, and so we divided the different chapters between each other, and I was the one who made the chapter on global health. So um, the main part of the session will be me showing you what the chapter looked like and giving you some insights about the visualizations and the background to the data, for example, or the design decisions we made building the visualizations, and also the flow of the story. So I sometimes call myself, well, I still call myself a data journalist, but sometimes one of the key aspects of my work is really about storytelling, about how to build up a story that flows naturally, so that people can keep engaged, even when the topic is quite data heavy or quite niche or maybe it might be an expert topic. So it's always a challenge to bring research and numbers to a wide audience. And so that is also something that I try to do in my work, and that is also what we try to do with Sustainable Development Atlas. So let's take a look at this first or the chapter about health. One key issue we had to deal with during the development of the Atlas, initially the launch of the Atlas was planned for the spring or early summer of 2020. So when we were working on the Atlas, the pandemic just crossed our work in a very, it impacted our work very badly, and it made us rewrite stories, add more data when research about the impact of COVID-19 became available. We added it to stories, so this took way longer than initially planned. And as you go through the atlas, you'll notice that many of the stories have some kind of section about Corona and the impact on that topic. And of course, the chapter on health was really important and became even more important when the pandemic was evolving. So I'll also talk about how the pandemic impacted our work building these stories. Um, a chapter about health in 2020, of course, yeah, the atlas was published in November 2020. So not talking about COVID-19 was, of course, not possible. And so we decided to start a story or have an introduction that introduces the state of COVID-19 at that time. You can see here that we have some numbers for the end of October 2020, so this is already outdated. Um, this is, of course, not easy to update it with current numbers, so we decided to pick a date and then stick with it, not change it afterwards. But the introduction is about COVID-19 and how how it started really, because the first visualization is a map about zoonosis events. So COVID-19 originally, or very probably, came originally from bats. So it was a bat virus that jumped to humans, and whenever diseases spread from animals to humans, this is called a zoonosis event. And some researchers found that these events are becoming more frequent, and they also researched in what areas in the world there's a higher chance for those events. So we took the map from research and we added it to the story to show that it's mainly areas with a high biodiversity and a high population that are at risk of becoming the source of one of those zoonosis events. Some aspects of this map, the first thing you'll notice if you check the legend is that there are no numbers there. You go from light red to dark red, and the only annotation there is a higher risk for the darker red areas. This is all about relativity. You have some probability of these zoonosis events in all regions of the world, basically. But the map is really only there to show you where chances are highest. And you can see that the eastern part of China, for example, has a higher risk. And this is also where COVID-19 or where the new SARS virus came from. So it's not meant to be a map that you can use to read numbers. It's just showing you a broad overview of where these events can happen. I can also show you where the map came from. It comes from a study that was published in Nature. And if I go here to the figures, um, let me put it full size. So it's the second map that we took, and you can see many differences. Of course, the most striking difference here is the colors. This map has a dark background. Of course, for our atlas, we are using a white background, so it would not be very nice to just take this map and put it into our atlas story. It would not really fit with the black background. And if you compare the shape of the countries, you'll notice that they are also a bit different. So the map is using a different map projection. We are for the atlas, we were using one specific map projection because the atlas obviously contains many world maps. So we wanted to be consistent in that area, and we are using an equal Earth projection, which is a very good projection for world maps because it keeps the area of the continents and countries true to their real proportions. So that is something that we really wanted. And so we used the equal Earth projection, which meant that we could not just copy this map. We needed to ask for the authors of the paper for the real data and to produce our own map. And I think this is something, it's a very healthy process. Instead of copying visualizations or tracing lines, for example, if you want to make your own version of a chart, it's much safer to ask for the source data and build your map or your charts from the source data. And this is something that is very common in media. A journalist would like to have a chart going with his article, and he only has a PDF with a chart in it, and then he probably might ask the people from layout to just trace the lines on the chart, but it's very easy to make mistakes in that way. So I would really recommend always make your visualizations based on the source data. So this is the introduction of the story. Um, then the story goes from the disease itself and where it came from to the impact on health systems and health system capacities. And so the second visualization here is showing you the health capacities, different aspects of health capacities in different countries. So the visualization at this point is showing you the number of nurses and physicians per 1,000 people, and each dot on this chart is a country. So you can use your mouse to hover over the dots to identify each country and to see how much medical personnel each country has. And countries are grouped into four categories, and these are categories defined by the World Bank, so they are using these categories a lot in their publications. So you have the low income countries, lower middle income, upper middle income, and high income countries. And you can clearly see that um, the higher the income, the more medical personnel countries have on average. These little black lines, they're not showing the average, they are showing the median, but you can see that median number of medical personnel is higher in high income countries. But you can also see, and this was actually the point of this visualization, that there is a very wide spread. Even in high income countries, you have countries with very few medical personnel, like in Bahrain, for example, while on the other hand, Belgium, where I'm from, we have a lot of nurses and physicians relative to our population. Um, so we choose this chart type, which is called a bee swarm plot, to show the distributions. We didn't want to only show the median or the average per income group. We really wanted to show that there's a big spread in these values, and that's why we choose the B-swarm plot. The B-swarm plot is also a nice visualization because you can represent each element in your data, in this case, countries. So people can find their own country if they look a bit into the data. Of course, there are no labels and there's no search box, so people might not find their own country, but that's not really the point of this visualization. I mentioned that we were using as much interactivity as we needed. So you see here these buttons on top, which you can use to show the number of nurses, the number of physicians, or the number of hospital beds for each country. That is, in other circumstances, we probably would have sticked with just medical personnel. But we wanted to show that health capacity is not only about medical personnel, it's about nurses. In reality, the numbers are about nurses and midwives, about number of physicians, but also number of hospital beds. So we didn't just choose medical personnel, we added these extra data for people who might be interested in those other numbers. One important thing when you're using interactivity to tell a story with visualizations is that many people might not find the interactive features. So people might not find that if you are hovering over these dots that you can identify each dot, or people might not get that these labels on top are actually buttons they can click on to show other data. In this case, it didn't really matter much because when you only see the first chart, the medical personnel chart, you already are getting the key message of the data that the user is presented with here. But in other cases, it might be helpful to guide the reader and explicitly say, well, you can use your mouse to identify countries, or you can click the buttons on top to show other data. So it should be obvious that charts are interactive when they are interactive. Um, and yeah, another lesson here is that your visualization should work without interactivity as well. So um, you should assume that a lot of your readers will not use interactive features when you're publishing interactive visualizations. So this is about healthcare capacity. The next part flows a bit after that. It's about healthcare access. Who can have access to healthcare? Is healthcare even available? And what are the financial risks that come with accessing healthcare? So we are using an index here. It's called the Universal Health Capacity Service Coverage Index. It's a mouthful, but it's really just a measure of how easy it is for people to get access to healthcare. Um, and again, we're using the B-swarm plot here to show basically the same thing. The higher the income of the countries, the higher the healthcare index. But you can also see that there is quite some spread, and that you have countries in low income countries, you might have very high healthcare coverage and high access to healthcare, while in richer countries, this index can be lower. Then a related issue to that is how access to healthcare can impact people's lives. And this is something that I really learned from building this story, is that in a lot of countries, or for a lot of people in the world, access to healthcare can mean yeah, can mean choosing between putting food on the table and getting access to health. Because healthcare in a lot of countries is expensive, and if your income is not that high, having an accident or becoming sick can mean that a substantial amount of your income needs to go to the healthcare service. So this chart is all about that. It shows you by region how many people each year are put into poverty because they needed to have access to healthcare. So um, this is yeah, it's, as you can see here, it talks about millions of people. So this is really an important problem, especially in South Asia, East Asia and Pacific and Sub-Saharan Africa. You have a lot of people that are pushed into poverty just because they needed to have access to some kind of health service. So health is not all about humans and their body and the healthcare system. It is also interwoven into the bigger social and economic system. So it also has a social dimension, and this is something that I only realized by building this story and making these charts. And the next chart is basically showing the same thing, but in a different way. And this is also a chart that I think is very interesting. Um, so what you're looking at on the x-axis here is the average healthcare service index. So it's the index that we've seen before. So if the higher or the more you go to the right, that means that countries or people in countries have better access to healthcare service. On the y-axis, we have the average share of the population facing catastrophic payments, which means that yeah, some people suddenly might need access to healthcare service, and they need to pay a lot of money. I think the threshold is 10% of their income that should go to these healthcare services. And you see four arrows or four lines of this on this chart. You have the low income countries here, bottom left, the high income countries here on the right, and then the upper middle and lower middle income countries in the middle of the chart. So where you want to be is on the right bottom corner of this chart, with a lot of people getting access to healthcare and very few people ending up paying a very or a substantial amount of their income to healthcare. And interesting thing is here is that you have a low share of population facing catastrophic payments both in high income and low income countries. In the upper middle and lower middle income countries, this share is much higher. And the interpretation that is given to this, and this is also explained in the text, is that in high income countries, the state or the government covers a lot of the healthcare expenses. So people don't have to pay the full bill themselves because the government is paying all or part of the healthcare. On the other hand, in low income countries, the government will not help people when they need to pay their healthcare bills. In those countries, either healthcare service is simply not available, so their people don't have to pay because the service is not available, or it might be that healthcare is available, but it's so expensive that a lot of people simply cannot access it. So that is the reason why the low income countries are also low in this chart. um, this is a very particular chart type. You can see that it's kind of a scatter plot. You have two dimensions, one in the x direction, one in the y direction. And we are connecting the dots for each year. There are 5 years in between each measurement, um, but we are connecting the dots chronologically. So this is a chart type that can show you trends in two dimensions at once over time. And it's sometimes called a connected scatter plot. And I think for this this data and the message we wanted to convey from the data, I think this chart really worked very well. It was actually a suggestion by one of the experts. So yeah, people with expert knowledge sometimes have a very good idea about how you can look at certain data sets they are accustomed to working with. So that was the case for this visualization. The next chart is also related to financing healthcare, and it's all about where the money comes from when people pay their bills in healthcare. Again, we are looking at different income groups from low income on the right to high income on low income on the left, high income on the right. And you can see that there are four sources of money when it comes to paying healthcare bills. You have out of pocket, which means that people are paying themselves. You have domestic public, which means that governments or other authorities are paying part of the healthcare bill. External sources, this might be NGOs, for example, and then you also have some other sources of money to pay for healthcare bills. And the interesting bit here is that you have a lot of out of pockets in low income and lower middle income countries, also a lot of external sources in low income countries, while in high income countries, the out of pocket money is very limited, so people don't have to pay a lot themselves. It's mostly the public money that is paying for healthcare. So I think this is a very interesting comparison, but as you can see here, we have these two buttons here at the top. At the moment, we are looking at relative numbers. We can also change it to absolute numbers. So we go from percentages to dollars or euros. And if we do that, the chart looks like this. And You can see that in low-income countries, healthcare expenditure is very low. And in the text, it is mentioned in low-income countries, spending on healthcare is 60 times less than in high-income countries. This is yeah, actually, this visualization with the two buttons is conveying two interesting things about the data. So the first one, what you see here is that in high income countries, healthcare expenditure is much higher. The second message here is that in relative numbers, people in low income countries pay a lot more themselves. And the buttons help in switching between the two, but in the explanation, in the text surrounding the visualization, both aspects of this data set are explained. So up until now, the story was mainly focused on yeah, healthcare capacity and healthcare spending. Well, we were developing the story. This was in spring. Already there was some new research about what lockdowns, for example, and what the impact of a lot of COVID-19 patients in hospitals might have on other diseases, for example. And we thought this was also something interesting, something important to show. And so in this section, we focus on child mortality. And we first showed that in almost all countries across all regions, child mortality is going down. So here you see something what is called a slope chart that is showing you the trend between two moments in time for each region in the world, and each line on each chart represents one country. So you can identify countries by hovering over these charts. Um, Identifying each country is not the main point of this visualization. We just wanted to show, well, in almost all countries across all regions, things are moving down, things are moving in the right direction. There are some countries it's going up still, but these are very, very rare. So yeah, it's improving. Then of course we have COVID-19, and some researchers calculated what different scenarios for lockdowns would mean if lockdowns were global, and so what that would mean for child deaths, but also maternal deaths. And so you can see here three scenarios, and for each scenario, we added the number or the additional deaths that would occur if this scenario would be reality. You can see that COVID-19 also has impact on child deaths, even if those are non-COVID related deaths. So it's impacting the health system, and as a consequence, it will also affect health outcomes. So why did we decide to use a table instead of a visualization here? Well, first, we needed to have the text describing each scenario in the visualization or in the table. So it would be very text heavy, and for that, a table is sometimes a better option than a visualization. And also, these numbers, there are not a lot of numbers. That was one reason not to go for a chart. And also, if you turn this into a visualization, it might give a false impression of certainty. Here we are presenting the numbers, but I think when you see these numbers here presented in the table, it's more about the range and the magnitude of the numbers, and not about the exact values of these numbers. So that is the reason why we opted for a table instead of a visualization here. We tried different things, but it never really worked, and we finally decided to go for a table in this section. We did the same thing for tuberculosis. So here we are showing the incidence of TBC in all regions, and you can see it's going down. In the beginning of the century, it was still rising in sub-Saharan Africa, but their incidence is now also improving. And we also have the death rate on the chart, which are the dotted lines here. And then again, there was a study that estimated the impact of lockdowns on the treatment of tuberculosis. And you can see that for these two lockdown scenarios, a lot of additional tuberculosis cases are estimated to occur, and also a lot of tuberculosis deaths. And we are talking about hundreds of thousands and even a million additional deaths. So this is something that I think we're only be able to spot in data some months or years from now, when the total impact on healthcare systems will be assessed. I think a lot of this is still under the radar, and hopefully this will become visible in the data in the months and years to come, because I think it's something that's not very well understood by the general public, that COVID-19 has an impact outside of the COVID-19 disease itself, because it impacts healthcare systems, and this has real life consequences. And then in the last part of this story, we focus on vaccination. And this chart here shows you the vaccination rates globally for different diseases. So you have TBC, measles, hepatitis, other things there. And you can see that in general, those lines are going up. This is, of course, what we want. One design aspect of this chart is this separate color legend. So you have the chart and the legend to identify each line on the chart on top, which means that people need to scan back and forth between the chart and the legend to identify each of these lines. I usually advise to put those labels directly on the chart to label each line directly, which makes it easier for people to read the visualization. But here there was not a lot of space here, because all these lines end up around the value of 80%. So they all lump together. So there's not a lot of space to put labels there. And also you can see that the text labels are quite long, because we also wanted to show what measure exactly was used. So you have, for some diseases, this is the percentage of 1-year-old children. For others, it's the percentage of children ages 12 to 23 months. So we wanted to show these details, and that made that there was not enough space on the chart to put the labels there, and that's why we used this separate color legend here. But I think good practice is to label lines in a chart directly and not with a separate color legend. Then we go on to talk about other vaccinations. This visualizations, they are called heat maps, and in this case they show you the immunization rate for measles for all the countries in the different income groups. So why did we choose to use heat maps here? Well, let me show you how this data in most cases is presented. And I'm going to use vaccination data, but for COVID-19 here, from Our World in Data, which is an excellent website, an excellent source of not only COVID-19 related data. They have many data sets about, many of them about global health. So if you're not familiar with Our World in Data, I can really recommend it. They publish all the data, but they also make a lot of charts that you can embed, and there are a lot of articles explaining what is in the data. So it really is an excellent source for global health data, but also for other kinds of data. So we're looking here at a chart about COVID-19 vaccinations, and you can see there are like 12, maybe a little bit more countries selected here. I can select more countries. Um, I'm just picking some of them at random here. So we probably have some 20 countries listed here, and you'll notice that the chart becomes a bit unreadable. You have a lot of lines close together, a lot of lines crossing each other. There's not enough room to label each line here on the right-hand side. So line charts have their limitations. If you put more than 10 lines onto a single line chart, you'll notice that it will become quite hard to read. And so there are other techniques um, to show many time series at once, and one of them are these heat maps. So each row represents one country. You can see some labeled here. So in the low income countries, it's Eritrea that has the highest vaccination rate. Here in lower middle income, it's Nicaragua. So each line is a country and each column is a year. So we are going from the beginning of the 1980s up until 2019. And as you can see, we are packing here some 200, no, they're probably less. I think there are some 120 countries represented in this visualization. This would be impossible to do with a line chart. Another thing to notice here is the color scale, and this went through many iterations because just like with COVID-19, measles has a threshold for herd immunity, which is around 94 or 95%, which means that if you manage to vaccinate 95% of the population, then you reach herd immunity and measles will not spread or only spread very limited among the population. So we wanted a visual cue to show this threshold. And so if you look at this chart, you can see that um, you have some of these rectangles being very dark. So we stopped the color gradient at this 94 threshold, which means everything above that would be just this very dark, intense purple, which makes it quite easy to spot the countries that have reached the threshold for herd immunity. And you can see that some countries reached the threshold, but then went back under the threshold. For example, these countries over here. So we tried many different things with this gradient. It was not the easiest thing to develop, but in the end, I think that the result is quite nice. It's pleasing on the eye and it's also informative with these very dark colors for the threshold for herd immunity.